In the last few weeks of pregnancy, everybody is anxious, excited, nervous, especially the first-time moms. So one of the things that we discuss with every new mom at this time is precautions of labor. And of course, every mother, especially late in pregnancy, will suffer from a little bit of contractions, and she's confused which one are serious, which one are not. So we try to explain to the mother that one of the signs of labor is contractions, and this contraction had the nature of progressively increasing, meaning you have it every 20 minutes, then in a few hours it's going to be every 15 minutes, then every 10 minutes, then every 5 minutes, and that's when you begin heading to the hospital. So many new moms are confused about those symptoms and they go more frequently. The difference between active labor and inactive labor, or we see latent labor, is the frequency increasing of contractions. And it does not relieve by sleeping. I mean, it doesn't go away by just sleeping to a side, while the false contractions does this. So to know that you are in active labor, just monitor your contractions, and they progressively get shorter in the interval, meaning 20, 15, 10, 5, and that's when you begin heading to the hospital. The second, in late pregnancies, there's a lot of discharges because the cervix begin to be what we call effaced, meaning shorter. The cervix is too long in the beginning of pregnancy, and it gets shorter progressively, especially when we go into active labor. The cervix is almost 1/4 to maybe 1/5 of the actual size at the beginning of pregnancy. And because it opens from inside out like a book, like this, that's what effacement is. You're gonna notice a lot of discharge, and especially in pregnancy. But in new moms, especially, the cervix, the first time to open, you're gonna find what we call the show, which is a little bit of mucus block, some blood with some mucus that comes out when the cervix begin to open in late pregnancy. And this is something else to monitor for. The third is, if you notice a lot of fluid, this is something that you need to notice. Rupture of membrane, which is you break your water, as you say it. And in this case, you're gonna find a gush of fluid, a lot of fluid coming into thighs and your legs, even if you're sleeping. And that's something that you need to go to the hospital right away, especially if it happens in late pregnancy. Beside monitoring very, very closely for those things that we mentioned, you need to monitor your fetal kick count, which meaning the baby movement. Under normal circumstances, your baby should move at least 10 times per hour, but of course it's very difficult to monitor for an hour and see what happens with the baby. So usually we discuss with patients that whenever you're sitting or lying in your side, give it half an hour, 15 minutes, and if you feel 3 to 4 movement, that's good enough. That should be okay to give you reassuring about your baby. And of course, if you felt no movement, you need to head right away to the hospital for monitoring and seeing what's happening with your baby. Stay safe, and see you at your delivery.